We are in an era of AI. Do it, it will reduce the need for doctors and it is
Yeah, maybe I will be replaced by a robot. Uh,
Hello and the on work.
Hi, Anand. Good to be here.
Many times is just get like it has the power to save human life. Yeah, I'm here. The doctor may move it. He is an expert in various forms of medicine and holistic well-being.
Thank you.
The man on my care.
I'm happy to be here, Anand. Thank you for inviting me.
Can you be the in human body holistic medicine and well-being?
Yes, the word holistic comes from whole, meaning that we take into account the entire individual, not just the physical body, but also their mind, their emotions, their spiritual well-being, as well as taking into account all the different systems of the body. Modern medicine has made a lot of advancements where it can look at a very specific part of the body and specialize in that. However, although it is very helpful in many cases, most of the time what we need is to look at the entire body and see how the different parts affect each other and take that into account. So holistic would mean looking at the heart as well as the kidneys, as well as the digestive system and the brain and the muscles and the joints, and also the patient's psychological, mental, emotional, social well-being.
We did to be in by holistic medicine.
Depends what the illness is, and there are certain traditional forms of medicine which use plant extracts, or in some cases also certain minerals or animal products, such as snake venom, for instance, is used, for example, in homeopathy. So it really depends on which part of the body has the problem or what kind of illness it is. Certain systems are better. For example, if somebody has a broken bone, then you need to go to an orthopedic doctor who can put it back in place and then put a cast on it. But then you can also have certain supplements and herbs which improve, help the body to heal the fracture better. So it really depends on what the situation is.
Some form of medicine is far from examining physically. Examining the psychologically correctly and really value helping it me visually emoji.
The way that allopathic medicine developed over time, over especially the last 150 or 200 years, they were focused on looking at the physical body, and they wanted to really become good at doing that. So if somebody is coughing up blood, is losing weight, is having fever, when they discovered that there are microbes or bacteria that cause certain illnesses, when the microscope was discovered, when they discovered that illnesses can be spread by contact, and they realized that it's by certain, so antibiotics were discovered, and in general medicine went into the way of doing more physical well-being for physical illnesses. And unfortunately, from the very beginning, mental problems, emotional problems, psychological issues like anxiety or depression or other more serious forms of mental illness were just pushed to the side. Like thousands of years ago, it was believed that maybe it's a ghost or a spirit that has entered the body and is haunting the person. Or even 70, 80 years ago, there were very limited medicines to treat psychological illnesses. So these people would usually just be locked up in institutions, in asylums, and different forms of treatment, like just tying them up or putting them in very hot or very cold water or giving them electric shocks. So psychiatry became a separate, completely separate branch of medicine. And even today, doctors in modern medicine, they are not given enough training in how to address certain psychological issues, which could also affect the physical body. So, for example, if somebody has diabetes, they have to check their blood sugar multiple times a day. They have to give themselves injections. They have to be so careful about what they eat. That itself can cause psychological distress. It can cause anxiety. It can cause lack of interest in taking care of oneself. And at the same time, if someone has a mental illness, let's say like schizophrenia, for example, or bipolar disease, then they can develop physical issues as well, because their mental illness is so severe that they cannot take care of themselves properly. They don't eat well. They don't bathe themselves. They're just not able to have a good social interaction with others. So all these factors are interdependent and they affect one another. So I'm not sure if I answered your question, but does that make sense?
Yeah. No, homeopathy, Ayurveda, holy, and naturopathy is very long and no.
That's true. It can take time because these systems, they give the body a chance to heal itself. So as you know, our body, the way it's made is it's really the most sophisticated organism or being. And for example, if we cut our finger, it does heal. It takes some time, but the cut heals, it stops bleeding on its own. Then there's a scar, and then that kind of, heals. So the body has a capacity, even in many illnesses, like it could be a simple cold, or it could be an infection. Many times the body itself does things like we cough. The reason we cough is so that the bacteria can come out. The reason we have fever is because when the temperature goes up, the bacteria or the virus get killed. They can't survive at higher temperatures. So the body does all these things, or for example, vomiting or diarrhea, or even when we have a stomach ache, because the body is trying to tell us, hey, there is something wrong. Please be careful. It is giving us a warning message, or it's trying to get rid of it on its own. So many of the traditional forms of treatment, like Ayurveda or naturopathy, they try to help the body's own system to heal itself. And because it's a natural process, it can take a little longer, the way it takes a bit longer for a plant to grow. Unless we do put some artificial chemicals in it to make it happen faster, in which case it has side effects. And of course, if I have a very bad headache, for example, I might take a tablet, a painkiller, ibuprofen, or maybe I will take some paracetamol or acetaminophen to help with the headache or the fever. But in the long run, it's best to avoid these medications if possible and allow the body to heal itself. Of course, in certain situations, you absolutely need to take allopathic or modern medicine if you have a life-threatening infection, or something like somebody has a heart attack, they have to go immediately to the hospital to get treated, or if they are in an accident. In those cases, you could lose your life or become permanently disabled if you don't get the treatment immediately. So unfortunately, there are these classifications. There are doctors who are only trained in modern medicine, or they are only trained in Ayurveda, or they're only trained in naturopathy. So they only stick to their own. But I think we need more education for doctors and for the general public, so that they're aware in which situation should you immediately get medical attention. When the doctor sees you, he or she should be able to distinguish that, oh, this case, we can maybe do some vitamins, some herbs, some supplements, or do some natural treatments, and they will be better. It's better to avoid strong medicine which has side effect, or oh no, this is a serious case. Please go to the hospital immediately. You need injections, you need surgery, you need immediate antibiotics. So the healthcare provider should be trained and have enough experience to be able to distinguish what to do in which case. Or if he or she doesn't know what to do, then they should at least know that, okay, I need to send this patient to a different specialist or a different kind of doctor. So to be open-minded about other forms of treatment, to have knowledge about other forms of treatment, and to also know my own limits to my knowledge. So if I don't know about something, then I shouldn't feel embarrassed to say, oh, I don't know about this. Maybe you should see a different doctor.
Yeah. How do you get
So again, it depends on the patient. Some patients, they want immediate relief. They are like, doctor, I have a cold, I'm coughing, I have a sore throat. I want antibiotics immediately. I want to get better. So in those cases, if the patient doesn't have some serious other conditions, like let's say asthma or lung disease or immune problems, or they don't look very sick, they don't have a high fever, they don't have certain, I might say, hey, why don't you try taking a lot of vitamin C and ginger tea with honey and lemon and do some steam inhalation and try to avoid milk products. I might give them some, this kind of advice. But if they're same patient, I also tell them, if you don't get better, or if you get worse, if you have shortness of breath, or if you get sick with high fevers, please call me back, make another appointment, and I will give you something stronger, or I will prescribe certain medicines for your symptoms. Or maybe I see the patient and they look really sick. They might have a pneumonia, they might have a bad bronchitis, and I might immediately prescribe antibiotics and some other medicines to help with their symptoms. Or if they're short of breath, they are a heavy smoker, for example, I might prescribe an inhaler. So it really depends, and it takes a long time, a lot of, you have to see a lot of patients and get the experience to be able to make that decision. And of course, being human, you're not always infallible. You can always make a wrong judgment or give antibiotics maybe when not needed, because the patient is really insisting, or because you don't want to take a risk. So it's always on a case-by-case basis. You have to use your best judgment, use the most recent medical research, and whatever has, the guidelines that are given by the various medical societies from different specialties. And also because each individual is unique, each human being is different. If you take 100 people with the same illness, they may have different symptoms, or they may have different reactions to the same medicine. So you really have to be careful to look at each patient in a unique way also. So I think that is also part of holistic medicine, where you take into account the individual characteristics and the unique situations of each person.
I have read the medicine will help part of the disease itself.
This
how did that your disease?
Okay, so this is actually a concept of homeopathy. So when homeopathy was first discovered about 250 years ago by Dr. Samuel Hahnemann in Germany, he noticed that there is a certain part of a tree that if you give it to a normal person, it causes fever and chills. So then he realized that if somebody already has fever and is shaking from the fever, if you give that part of the tree to actually specifically the cinchona bark, from which quinine or the original medicine for malaria was made, he noticed that it actually helped the symptoms. So the very substance that produces certain symptoms in a healthy individual, when you give it to somebody with that illness, it actually helps them feel better. So that is the basic philosophy of homeopathy.
Yeah.
And so homeopaths use certain substances, like even substances that could be toxic, like for example, the poison of snakes, snake venom, or a part of cancer of a patient. And they take a very little bit and they dilute it in alcohol multiple times. They shake it multiple times and they keep diluting it and shaking it. It's a process which is called potentization. And then they give it to a patient who is suffering from those similar symptoms. For example, if somebody gets bitten by that snake, they have certain symptoms. They take a little part of that snake venom, potentize it, and then give it to a patient who has similar symptoms, and then they feel better. So this is a very controversial topic because there are many groups, especially in modern medicine, that are against this philosophy, and they believe that it's not scientific and that it does not work. But of course, in countries like India, we have, homeopathy is recognized by the government, and there are medical schools that teach this system of health. And in my personal experience, I have had, since childhood, I have had certain times when I was ill and I was offered homeopathy and it helped me. And also sometimes I have tried homeopathy and it didn't help me. I think it really depends on how good the doctor is. It depends on, because it's a very difficult system of medicine. And especially these days, because there are so many toxins in the environment, people take a lot of, they are prescribed a lot of antibiotics from a young age. They are not very healthy. So homeopathy tries to stimulate the body's innate power to heal itself. It doesn't try to go against the body. So for example, if you have a fever, if you want to have paracetamol or crocin, a homeopath will say, no, don't take that medicine. Let the body have the fever. It's going to actually help cure it completely, cure the illness from the root. So I'm not a homeopath. I studied Western medicine, and that's what I practice. But what interested me in homeopathy is that they take into account the emotional and mental as well as the physical symptoms. So it's very fascinating for me. I like to read about homeopathy. but it's not something that I practice or routinely prescribe for my patients. Unless it's a friend or a family member, I can sometimes recommend homeopathic medicine.
Largo en el nombre even the your
Yes, that's quite unfortunate. So cancer cells do come back sometimes, probably because they have not been all completely destroyed. So depending on the type of cancer, depending on which part of the body it is affecting and how much it has spread, there are different types of treatment which we are familiar with, which can include surgery, chemotherapy, radiation, immunotherapy, where there are actually medicines that stimulate, that go after the cancer cells themselves. So a lot of incredible research has been made in cancer treatment, which helps many patients. But unfortunately, sometimes it's genetic, that the patient's system itself, the body, is not strong enough to fight the cancer completely. And there could be a lot of reasons for it. It could be because there were toxins in the food, like, for example, the pesticides that are used on fruits and vegetables, or certain chemicals that are released from factories and they go into the water system and into the ground, and even the fumes from cars and from tractors, from trucks. So we are constantly bombarded by chemicals and by substances that can cause cancer. And our body, our immune system, is actually beautifully designed to kill these cancer cells. So every day, me and you, we have cancer cells in our body which are being destroyed by our immune system. So sometimes when our system is weak, and due to various other reasons, such as hormones, or as our age increases, or, you know, women have more risk of certain cancers in certain age. So it's a very complicated situation with many different factors which are involved. So it's not always possible to exactly pinpoint why the cancer comes back in some cases, and in some cases it's completely cured and goes away. But one of the things that has been proven and that has been researched is that having a positive mindset and being getting emotional help, psychological help, has actually prevented sometimes the cancer from coming back. This doesn't mean that if the cancer comes back or if it doesn't get cured, it's the patient's fault. It doesn't mean that they were not positive or they were not in a good emotional state. Sometimes it's hard to tell. But again, most cancer centers now, especially in the United States, they do accept that holistic treatment is necessary. So not just chemotherapy, not just surgery, but also mental health, also being, you know, eating healthy, taking good vitamins, being happy, being surrounded by friends and family. All these things have a positive effect on curing cancer.
for in do for many what the